Hello, I am Dr. Todd Marr with the American College of Allergy, Asthma, and Immunology. Because of the need for involvement of patients with their allergists in making healthcare decisions, the college, along with the Allergy and Asthma Network, has developed a shared decision-making tool for allergists to use with their patients considering allergen immunotherapy. Shared decision-making, also called SDM, is a more formal arrangement for what we already should do. Explain the risks and benefits of all available treatment options so the patient can make the best choice for themselves. But true shared decision-making involves taking into account the individual patient's preferences, beliefs, and customs. It also presents the information in a way that is sensitive to the individual patient's level of health literacy. Many patients wish to be active participants in their own health care, and they want to be involved in making decisions about their medicines. Patient decision aids can support allergists in adopting a shared decision-making approach in an allergy consultation. They ensure that patients and their family members or caregivers are able to make well-informed choices that are consistent with the person's values and preferences. That is where shared decision-making aids come into play. Shared decision-making aids help the allergist collaborate and make healthcare decisions together with their patients, taking into account the best scientific evidence available, as well as the patient's values and preferences. SDM honors both the provider's expert knowledge and the patient's right to be fully informed of all care options, as well as the potential harms and benefits. The process provides patients with the support they need to make the best individualized care decisions while allowing providers to feel confident in the care they prescribe. SDM is particularly important when there is more than one clinically appropriate treatment option for the condition, each with benefits and drawbacks. The patient's values and preferences should be critical in determining the chosen intervention. Patients sometimes make decisions about medical treatments without completely understanding the options. Decision aids present the various treatment options in an unbiased, balanced way to patients so they can make an informed choice. These tools, which are designed to complement rather than replace counseling from a healthcare provider, can be used to facilitate a shared decision-making conversation between patient and provider. The college's SDM aid for allergen immunotherapy assumes that you have already performed specific IgE testing, encouraged your patient to employ relevant environmental controls, and achieved maximal medical therapeutic results based on the patient's wishes and tolerabilities. We included a brief discussion of medical management for patients wishing to review it. The tool discusses the risks, benefits, and application of subcutaneous injection therapy and sublingual therapy with FDA-approved tablets. Because patients may have heard of sublingual drops, we make mention of this form only in that it is not FDA-approved, not covered by insurance, and therefore not considered further. Throughout the tool, several questions are asked of the patient to identify their individual preferences about the various aspects of these forms of immunotherapy. These responses are displayed back to the patient at the end of the tool as a means to facilitate their decision. The intent is that you can discuss these responses as shown on the screen in your office or print it out for the patient's convenience to further review their questions and help them reach the best possible decision. It is expected that long-term adherence to therapy will be enhanced by a more thorough understanding of all their options.
The shared decision-making tool digs deeper into the information patients need to know about subcutaneous and sublingual immunotherapy and provides the option to print out the results for further discussion. The tool describes the shared decision-making process and begins by identifying the short-term and long-term goals for treating their allergies. The discussion begins with a review of environmental controls and the medications used to treat allergies. Further information is available with the blue buttons on this page. Clicking the word allergens lists common seasonal and perennial allergens. The patient returns to the overview and then clicks on Environment to review some common environmental controls. After returning once again to the overview, they can click on the word Medications to review the 6 main classes of medical management options that are recommended. After scrolling to the bottom of the page, they can return to the overview and then move on to the next page. Several questions are presented throughout the tool to gather the patient's preferences. All of these questions are set up on a 5-point scale where 1 is disagree strongly and 5 is agree strongly. On this first page, the patient is asked about their ability to control their symptoms with environmental interventions and medications. Immunotherapy is then introduced as a means to modify their reactivity, and the 2 delivery methods, injections and tablets, are described. Because patients may have heard of sublingual drops through various avenues, mention is made that drops are not FDA approved, not covered by insurance plans, and therefore will not be further discussed. The next page is a table that compares side by side the allergens we can treat with SCIT and SLIT, how they are dosed, and the duration of benefit that can be expected. The medical benefits of immunotherapy are then described with indications made as to which can be achieved with shots and tablets. This is followed by 3 questions that explore the patient's treatment preferences, asking the patient if they are willing to do a little more work to control their allergies, whether they prefer to treat their allergies at the source, and assessing their interest in immunotherapy as a means to reduce the chances of developing asthma. The next page drills deeper into what is involved with immunotherapy, highlighting that SCIT is available for all relevant allergens, listing the allergens for which SLIT is available, what can be expected in terms of onset of action, and mentions the role for epinephrine autoinjectors. The side effects of immunotherapy are next compared side by side, detailing the potential local and systemic side effects. These are summarized on the next page. The tool then hones in on critical decision points in this choice of therapies: fear of needles, fear of adverse effects at home without a physician present, and whether they're okay with treating a single major allergen as opposed to multiple relevant allergens. Preferences towards each type of immunotherapy with respect to these potential adverse effects are elicited on the next page. Costs for immunotherapy are outlined side by side, with recommendations guiding the patient to explore these costs with their insurance carrier, with a comment about the pharmacoeconomic studies that show that total healthcare costs in children are decreased with SCIT. Importance of these cost concerns are assessed on the next page. The patient is then presented with the ready questions relating to their willingness to start immunotherapy. Encouragement is provided for further discussion with the provider if the patient cannot confidently respond to all of these questions in the affirmative. The concluding page provides the option to download a PDF of the assessment questions and their responses. This page can then be printed out for further discussion with the prescriber, highlighting those issues to which the patient made middle-of-the-road responses and will benefit from further explanation.
After the patient finishes the SDM tool and you go over the answers provided, the patient may have additional questions about immunotherapy that may need further clarification. Here are a few questions that may come up during your discussion of the results of the immunotherapy shared decision-making tool.
Dr. Stephen, how do I know if I need to be treated with immunotherapy for all of the allergens I showed positive allergy tests to?
Just because you have a positive allergy test doesn't necessarily mean it causes you significant symptoms. What we can do is go through your test results one by one to decide which ones need to be treated and which allergies don't cause a lot of trouble that can't be treated with medication alone. Many people have several mild allergies that can be controlled for the most part, but are really miserable during the grass or ragweed seasons, or find that their dust mite allergy causes the most trouble for them. These are the folks for whom a sublingual tablet might be the best fit. But people who are really bothered by several allergens, especially those for which we don't yet have sublingual tablets, such as tree pollen and cat dander, might prefer to have these allergies treated with subcutaneous immunotherapy.
The SDM tool says I don't need to have an epinephrine autoinjector for SCIT, but I must have one for SLIT. Why is that?
Since SLIT is done at home, there should be an epinephrine autoinjector available in the rare case of an allergic reaction. SCIT is given in the office and you wait 30 minutes before leaving. If a severe reaction were to occur, it would usually happen during that 30 minutes that you would still be in the office, so that we would be able to treat you for it before you leave. Some allergists do give all SCIT patients an injector to have on hand for the rest of the day to be on the safe side.
If I do immunotherapy, how likely am I to really feel better?
Immunotherapy, both SCIT and SLIT, leads to significant improvement in nose and eye symptoms, though not as quickly as medication. Over time, there's less or no need for allergy medication with immunotherapy. Immunotherapy may last long-term after it is stopped and prevent the development of other allergies and prevent or improve asthma symptoms. On the other hand, once you stop medication, all symptoms can come back as soon as the medication gets out of your system.
How do I know what the costs of SCIT or SLIT will be for me?
We can help you get the information you need from your insurance company to understand how much each type of immunotherapy may cost you out of pocket.
With this immunotherapy shared decision-making tool developed by the American College of Allergy, Asthma, and Immunology and the Allergy and Asthma Network, you and your patient can partner to determine what is the best approach for the optimal care of their allergies. As you use this tool in your allergy practice, we would like your questions and feedback on how to make it better, so please contact the college at info@acaai.org. Thank you.